What will I gain from this video? After watching this video, you'll be able to confidently identify the hilum on PA and lateral chest x-rays. The word hilum is taken from Latin and means a depression, pit, or a little something. Unfortunately, on a plain x-ray, we cannot identify the depression that's on the medial aspect of the lungs. The Fleischner Society defines hilum as the composite shadow of the root of each lung produced by bronchi, arteries and veins, lymph nodes, nerves, bronchial vessels, and associated alveolar tissue. Most of these structures, however, are not identifiable on plain X-ray examination. So in fact, when we refer to the hilum in daily practice, we refer to the whiteness within the hilar areas produced by the pulmonary arteries. The hilar regions lie within the central portion of the hemithoraces and can be seen as extension from the mediastinal areas centrally on the PA film and can be identified as a white area within the central portion of the thorax on the lateral X-ray. The main pulmonary artery starts on the left side of the body. It measures approximately 6 centimeters in length and 3 centimeters in diameter. At approximately the level of the carina and just below the aortic arch, it bifurcates into two main branches, the right and the left pulmonary arteries. The right pulmonary artery is a long structure. It's long because it has to get to the right lung from the left side. It courses horizontal and lies anterior to the airways, which is an important point. Shortly after entering into the right lung, the right pulmonary artery divides into a large superior trunk called the truncus anterior and a large descending branch called the intralobar branch or descending branch of the right pulmonary artery. Notice that the descending branch courses vertically. The left pulmonary artery is a short structure. It is short because it starts on the left side of the body and doesn't have far to course to get into the left lung. But in order to get into the left lung, it has to course over the left mainstem bronchus and is directed from anterior to posterior, as we've outlined here on this illustration. The left pulmonary artery has a large descending branch or intralobar branch, but doesn't form a trunk superiorly, but has separate 2, 3, and sometimes 4 branches to the left upper lobe. So the pulmonary arteries form roughly the letter H on the PA X-ray. More peripherally within the lungs, the pulmonary arteries continue to branch and decrease in caliber, and approximately 1 centimeter from the pleural surface are no longer visible on plain X-ray examination. Because the left pulmonary artery is coursing over the left mainstem bronchus, the pulmonary artery will be seen as a white area positioned approximately at the level of the left mainstem bronchus and below the level of the aortic arch. So in order to identify the pulmonary artery on the left, we would be looking for a whiteness in the area directly adjacent to the aortic arch. On the lateral view, we will be looking for a white area that's extending from anterior to posterior, arching over the left mainstem bronchus. So how do we identify the left pulmonary artery on the PA examination? First, we make sure that the patient is properly centered and is not rotated. Next, we focus our attention to the mediastinal area on the left centrally. We identify the trachea and the left mainstem bronchus. We identify the superior margin of the left mainstem bronchus. We then visually follow the whiteness above the left mainstem bronchus obliquely until we identify the grayness of the lung. This transition from white to gray represents the superior margin of the left pulmonary artery. Just superior to the left pulmonary artery on the PA examination and adjacent to the aortic arch, there is a clear lung space that is called the aortopulmonary window. On the lateral view, we will also expect to identify aortopulmonary window situated between the aortic arch and the left pulmonary artery. How do we identify the left pulmonary artery on the lateral? The first step is to identify the trachea. The next step is to identify the aortic arch. We then follow the whiteness of the aortic arch inferiorly until we identify the aortopulmonary window. We then follow the blackness of the aortopulmonary window until we encounter a second arch. This represents the superior margin of the left pulmonary artery. We can verify that this is the left pulmonary artery by its position coursing from anterior to posterior across the airways. And on the lateral x-ray, the left pulmonary artery will look like an extension of the right pulmonary artery arching posteriorly. Most of the right pulmonary artery is going to be hidden within the mediastinum and cannot be identified directly. However, we can identify clearly the descending branch of the pulmonary artery, which is seen as a vertical structure that lies parallel to the right heart border. The right pulmonary artery can be clearly identified here on this examination, separate from the right heart border. We can confirm that this is the artery because it is branching more peripherally. The right pulmonary artery to have an oval shape because of its horizontal course, which would then make it parallel to the X-ray beam on the lateral examination. So how do we identify the right pulmonary artery on the PA examination? First, we make sure that the patient is properly centered and is not rotated. Then we focus our attention to the lower mediastinum on the right. We identify a vertical branching structure that lies parallel to the right heart border, and this is the descending branch of the right pulmonary artery. We then follow this artery superiorly to the mediastinum. We can then infer the position of the right hilum based on the position of the descending branch. We can also confirm the location of the right pulmonary artery by identifying the left pulmonary artery. The left pulmonary artery is positioned usually higher than the right pulmonary artery. The difference in height of the pulmonary arteries is because the left pulmonary artery arches over the left mainstem bronchus. How do we identify the right pulmonary artery on the lateral x-ray? The first step is to identify the trachea. Now, the trachea is important because the right pulmonary artery will be positioned in front of the airways. We identify the mainstem bronchi. Next, we follow the anterior border of the trachea inferiorly until we encounter a oval-shaped white density. This white density is made predominantly by the right pulmonary artery. We can confirm that this is the right pulmonary artery by identifying the left pulmonary artery, remembering that the left pulmonary artery will appear as an extension of the right pulmonary artery arching posteriorly. So to recap, the proximal pulmonary arteries form an H shape on frontal x-rays. There are two arches on the lateral, the big arch formed by the aorta and the little arch formed by the left pulmonary artery. The right pulmonary artery forms a white oval on the lateral x-ray anterior to the airways and is the whitest soft tissue structure on the lateral. The left hilum is higher than the right because the left pulmonary artery arches over the left mainstem bronchus. On the frontal x-ray, the superior edge of the left mainstem bronchus is equivalent to the bottom edge of the left pulmonary artery.